All right, now we're going to begin with the right upper extremity sequence. And before we begin, I want to explain to you just the anatomy and physiology of how basically what we're doing so you understand where we're moving the fluid. So in this instance, we've had some lymph nodes removed on the right side, and we're going to be moving the fluid across to the unaffected side because there is a capacity for this armpit that's healthy to take up some of the fluid that we're pushing over there, as well as down in the groin on the same side as our affected area. So we'll be pushing the fluid down to the belly, down to the groin area, to what we call the inguinal nodes, and over to the axillary nodes or the opposite armpit across the chest. And before we begin that, we'll be doing a belly sequence. And in the belly, I'm referring to all within the hip bones and underneath the rib cage, because the belly is kind of the grand central station area of the lymphatic system. So we have a lot of lymph nodes and lymph vessels that we want to activate there to really start the lymphatic fluid moving. So with that, let's begin. First of all, what I want to focus on is the belly. And in the belly, we're going to be starting over on the left-hand side. And all of the exercises that we do, we'll be doing about 5 to 7 times in each area. So first, let's take 2 hands, put one hand between underneath your rib and above your hip bone. And I just want you to push that fluid in towards your belly button. So it's kind of a motion like this, where we're pushing in to the belly and relax, and in and relax. And you can do this 5 to 7 times. There. And next you can work under, or just above your hip bone, kind of just pulling that tissue up towards the direction of your belly button. 5 to 7 times on this side. And then you can move over to the other, just inside the hip bone over here. Move that tissue up towards your belly button. Up and up. So 5 to 7 times there. So we've done both hip bones. Now just underneath the rib cage, I just want you to push that fluid in. Just push that tissue in and relax. And in and relax. Not necessarily down, but just push it in and relax. And after we've done that 5 to 7 times, you can kind of walk over to the center and push it in and relax. And in and relax. And in and relax. In and relax. So 5 to 7 times there. And lastly, we're going to complete it just underneath the ribs on this side. In and in and relax. And in and relax, and in and relax. So that completes the first set of our belly exercises, but the next one is deep breathing. And to do this, I want you to put both hands on top of one another. I want you to breathe in through your nose, and as you exhale, we're going to be pushing down into the belly. You're going to hold that pressure until you breathe air in, and I want a good deep abdominal breath so that you feel the air coming down into your abdomen. And then when you've breathed in, you've taken the breath in as high as you can, then you're going to move over to the side and we're going to push the air out. So let's begin here. Just put your hand over your belly button, and now breathe air in through your nose. And now exhale and push that air out. Hold that pressure and breathe air in. And now before you breathe out, I want you to move over to the left side and push that out. Hold that pressure, breathe air in. And now move back to the belly button and breathe air out. Okay, hold that pressure and breathe in. And now move over to your right side and push it out. Hold that pressure. And finally go back to the belly button and breathe air out. Now that completes the belly section, and now we're going to be working above the collarbone. This is an important area because this is the area where the lymphatic fluid re-enters into the venous system or our circulatory system, our blood system. And so to do that, I want you to just sit up a little bit straighter, like our moms used to tell us. And I want you to sit up, and I want you to take your shoulders, and we're going to be doing some shoulder circles where I want you to lift your shoulders as high as they'll go and then back. All right? So we'll be doing some big circles where you lift up and back and up and back and up and back. So you can do this about 5 to 7 times. Next, we're going to be working on the skin on either side of your neck. And to do that, first of all, I want you to kind of keep your shoulders level. Don't compensate with putting one shoulder up over the other, but try to keep nice and steady. And I want you to take your ear and bring it over to your shoulder and then up. Let's do that again. What we're looking at is trying to stretch the skin on our left side of the neck and then up. And now we're going to go over to the right side, stretching the skin on the right side of your neck and then up. So go on back this side, where we're stretching the opposite side of the neck, and then up and over here and up, and we'll do one more. This, I think, if you could do 3 times on each side, that'll be sufficient. Up and over and up and over. And then lastly, with above the area above our collarbone, I want you to take a look at turning your head so that you're looking over your shoulder, trying to keep your shoulders straight ahead, not lifting one way or the other, but just taking a look, just twisting your neck, looking over your shoulder in this direction. And then slowly I want you to take a look at turning your head in the opposite direction. We'll do that 3 times. We're going to look over this shoulder, and then this shoulder, and now we're going to go one more time on either side. So we're going to look over your shoulder and back and over your shoulder and back. And then lastly, I want to take a look at moving the fluid into this area that we call the supraclavicular fossa, just the area, this little hollow that you see above the collarbone here. And to do that, I want you to take some flat fingers just above the collarbone. Don't push on the collarbone because that can be kind of painful, but if you work flat fingers, and now this isn't with your whole hand, but just with your flat fingers, I want you to take that skin and move it in the direction of your neck, down to the collarbone, and relax. Again, flat fingers, not fingertips. You don't want to squish the vessels that are underneath. But we just want to move and activate those the lymph fluid and the lymph vessels, and push that into the supraclavicular fossa here. Okay, so with flat fingers, we're just activating and opening this drain. It's a viable area that we can move the fluid from our affected side into the circulatory system. Okay. To begin with next, I want to take a look at opening up the unaffected armpit or axillary area. So here, I want you to put your hand right in your armpit, and you can activate by moving that fluid up, kind of in the direction, pulling it towards your heart. And you want to pull it up. And you can actually, when you're working that armpit area, you can work underneath the axilla, pulling that fluid and the tissue into the armpit. And you can also work above the armpit on your upper arm. Essentially, we're just really trying to clear this area out because this is the area where we want a lot of the fluid to go. So once we've cleared the armpit area, and if you feel like you have a lot of fluid that you want to move, feel free to put this on pause and just really work this area. Just open up the whole unaffected axillary or armpit region. Next, what I want us to do is we're going to work above the breast. And so we're going to be moving the fluid from this whole section, from your breastbone in the middle, across. So you're going to move across breast, doing that stationary circle again where we're pushing in the direction of the armpit, and relax. And you can do this 5 to 7 times where you're just moving across the chest. So you go across the chest and then kind of work it into the armpit. And next you can go just directly across the breast. Stationary circle where you're really pushing and you're emptying that fluid. And again, this is on the unaffected side. And we're just moving it on up. So 5 to 7 times that you can go across the breast in a stationary circle, stretching that skin and relax. Stretch and relax, and then work it up into your armpit. And next you can work underneath the breast, taking that tissue, stretching to the side and relax. Stretch and relax. Stretch and relax. Stretch, relax, and then work it on up into the armpit area. Okay, next we want to open up the transition between your unaffected and your affected side. And to do that, I find sometimes it's easier to put 2 hands, and you're just going to take that tissue. We're moving in the direction of our unaffected armpit. But I want you just to take that skin and stretch as much as you can go and relax. Stretch and relax. Now it's fine if you've had radiation. You might want to check with your therapist just to make sure, the amount of stretch that's safe for you to do over your radiated area. But this is perfectly fine to do if your scars are healed, if you've had implants, if you've had a lumpectomy, reconstructive surgery. Again, just check with your therapist, but generally moving that fluid across and up is just fine. If you're now just moving and opening up that transition area, which is this whole area between right and left. And so what I wanted us to do is we can move here, we can actually move in the center here. Now I'm not just stirring a bucket of water here, I'm really pushing in the direction of my unaffected side here. So I'm pushing and relax, pushing and relax. Sometimes I've had patients where they're pushing in both directions and then that doesn't do anything. But if you can really focus on pushing in the direction that you want your fluid to go. Push and relax. Push and relax. And push and relax. And now we're able to start working on our affected side. So here I think if you take both hands perhaps and just take that skin and pull it and relax in a stationary circle. So you're going over and relax 5 to 7 times above your breast, and then you can just kind of start flushing it out, working it over to the opposite axilla. And now once we've cleared the upper breast, we can go right across the breast, and we can do the same stationary circles where you're working across. And again, this may be an area where you've had some radiation, so check with your primary therapist just to make sure that it's safe to push the skin. But generally, if you are healed, if you've had reconstruction, this should work out fine. This should be fine to do, and it's a very effective way to move the fluid from your affected side over to the unaffected side. So all of this you could do 5 to 7 times above the breast, 5 to 7 times across the breast, and you could do 5 to 7 times beneath the breast, moving the fluid over underneath the breast, and then just redirect it going up to the unaffected armpit over here. Okay, so at the beginning I talked about this pathway but across the chest, but there's also another pathway between the armpit and down to your groin here. And to work on the groin, I want you to take your fingers. There are lymph nodes that we have right beneath the top of your leg and your body. To do that, I want you just to put your hand here. The direction is we're just going to pull in and relax. So you're going to pull it up, in, and relax. 5 to 7 times here. Up and relax, and up, relax, and up, and relax, and up, and relax. And next what I want us to do is take a look at moving the fluid down across the body. So we're going to take a look at this in being 3 sections. Down on the lower portion, just beneath your waist, pushing it downwards 5 to 7 times. And then moving it on up to the waist. And again, think back to what we talked about at the beginning, the tempo. Sometimes at this point you want to start just finishing up and getting quick, and we want you just to stay at the same tempo of just kind of pushing it down and relax. You'll be far more effective and you'll be able to move the fluid a lot better if you stay with a good tempo. And then just underneath on the side here. Down and relax. Down and relax. And sometimes it's hard to know if you are not very flexible. Perhaps it's easier just to take this hand and put it under and pulling that skin downwards. So once we've gone all the way up, we can just push that fluid, work it on down, kind of like you're flushing that fluid on down to the inguinals on the same side. Now, once we've worked up here, we can actually put our hand, and we're going to begin with the stationary circle. So put your hand at the top of the shoulder, and we're going to be working up. So take that skin and move it up. We can do this 5 to 7 times. Again, paying attention to my freckle that I have here, watch how that skin is stretching. When you're doing a stationary circle, the goal again is to stretch the skin. Don't slide your hands on the skin like you're super glued to the skin. And then you can take this and work it into the area just above your collarbone with flat fingers, just trying to move that fluid up and into this area. So now once we've worked on the upper part of our arm, we're going to officially be working on the outside part of the arm and then the inside to the outside. So we've worked here, just put your hand down one here, and you're just going to go up and relax. Up, relax. Stationary circle, up and relax. Up and relax, and up and relax. And next, your hand is going to go just above the elbow, and our direction is up. So we want to go up and relax, and up and relax, up and relax, and up and relax. So once you've done this 5 to 7 times, we can go to the top of the arm and go in to out. So you can go 5 to 7 times, just taking and stretching that skin to the outside part of your arm. 5 to 7 times there. And you know, I've got large hands that might be at home. Maybe your hands are smaller, so you may have to do a few more of these segments, in which case just put this on pause until you've completed this section. But you're just moving in to out. In to out. Now once we've done this, I want you to just think of doing that pump where we can go up, relax, and just flushing that fluid up your arm. And we can go right up above the collarbone here. We can bring it across the chest. You can work at doing that whole chest sequence where we're bringing and flushing that across the chest. And we can also work it down. Now, effectively, oftentimes a lot of people have swelling right in this area. And I'd say here, just take your hand, if you're able to, put it on top of your head, and let's work at just pulling that fluid down and relax. Down and relax. And so we're going to be working this back side of your arm, down and relax, and down and relax, and then go up to the elbow. So this is just a stationary circle. I'm pulling the fluid down, relax, down. And once I've done that, I can kind of continue and kind of flush that out. Because we want to get it out of this quadrant. We want to get it out of this area. And we can push it along underneath in your axillary region here. You can actually go a little bit behind the armpit as well. And we're pulling that fluid down the side of your body, down to the inguinal nodes on the same side. Okay, so now once we've completed that, now we can look at the elbow. And we have both sides of the elbow that we want to work at. If you can take your flat fingers and put it right in the crook of your elbow here, and we're just going to do a stationary circle here. So up and relax, and up, relax, and up, relax. So 5 to 7 times of a stationary circle in front of your elbow. But also an important area for a number of people is just around the elbow bones here. So when you bend your elbow, you can see there's a little divot between this bone and this bone. And you can actually do a stationary circle with your fingertips, and you can kind of work that area. It's okay to work and push that a little bit deeper. And you might just feel that it gets a little deeper, but as you work it, it might soften up. So just take a look at moving that with your fingertips in a stationary circle up. So if you've done it 5 to 7 times on this side, you can also work on the other side of the elbow. And I don't know if I turn here, if you can see that a little bit more, but I'm just pulling and doing some stationary circle going up in this direction. See, you can feel the other side of your elbow bone. And then once you've done that, you can follow up by flushing it out and going on up the arm and moving it either across to your opposite armpit or down your side of your body. So after we've completed the elbow part, now we're looking at the forearm. And the forearm, we just want to move the fluid upwards. So here we've got both the top side of your arm as well as the bottom side of your arm. So here, just 5 to 7 times, you're just going to put a relaxed hand on your arm and pull that skin up, and relax. And then up and relax. Up and relax. And up, relax. So if you've done that 5 to 7 times, then you can move on down. And you just go up and relax. Up, relax. Again, focus on supergluing your hand to the skin so that you can really be effective in moving the lymph fluid. By stretching the skin, we're activating the lymph vessels beneath the skin. And down by your wrist, just up and relax. And we'll work up by the elbow. And then we'll work a little bit down your arm. and down by your wrist. Really focus on stretching that skin and stretching the skin as much as it's going to allow, and then just relaxing, letting that skin rebound to its original state. Okay, so now we've just completed the forearm, and now we're going to the back of the hand where we can work on the wrist. Again, with stationary fingers, we're just going to put our flat fingers on the back of a wrist, and we're just going to do some stationary circles where you're moving up and relax. So after you've done the wrist about 5 to 7 times, then just take your hand and put it back here on top of your hand and stretching that skin. See, I'm even stretching it so much that my fingers are moving upwards. But sometimes and you're just going to do a stretch like so with your fingertips. Stationary circles, but just with your fingertips, working between all the bones. So again, you can do that 5 to 7 times between each of the bones in your hand. And if this is a problem area, put me on pause and just keep working this area until you feel like the fluid is moving a little bit and it's softening up. And depending on how much fluid, you might follow up by flushing keep going and flushing this fluid on up the arm and then over to your unaffected armpit, or pushing it down to the inguinal nodes on the affected side. So there, I've done the stationary circles with my fingertips, but it's also very effective to just do your hands if that works. And then lastly, we're going to be working on the fingers. And to do the fingers, I like to use my stationary circle on my hand with my thumb, and I like to just push with my thumb, pushing in the direction of my wrist, and kind of work at the base of the thumb first, and then work your way out towards the fingernail. And then once you get towards the fingernail, then you can kind of just push all that fluid back down. You can work to the next finger, stationary circle with your thumb. And then you can work over the knuckle. All the way to the end. And then at the end, see how I almost take my fingers here and I just kind of push the fluid on back down the finger, just like that. Working to the next finger. So all the fingers, you're just taking that skin, the same principle, but it's just on a smaller surface area. You're just taking a stationary circle and you're stretching that skin back towards your hand, working to the end of the finger, moving the fluid on all sides of the finger, and then pushing that fluid on back down. Okay, so now we're just working on the finger, just doing the stationary circles from the base of the finger all the way out to your fingernail, and then push that all back. And lastly, we've got the little finger here. I can even use my index finger on this side to do some pushing of the fluid. And push it all the way down. So now I'm going to follow this up and push all of this fluid back to all the areas that we prepared at the beginning. So that would be the opposite axillary or armpit area, the inguinal area, and the area just above my collarbone. Again, you're just pulling that skin upwards, taking care not to push too hard, dig in too hard with any fingers or thumbs. And we can work it right into above the collarbone area here. We can take that fluid and work it on back down along the side of our body here. There we go. We're almost done. And next we can work it across from above your arm, and you can work it across your chest over to the opposite side. Again, taking care of any area that you're moving that's radiated. Just check with your primary therapist to make sure that it's safe for you to stretch that skin. But generally, if your scars are healed, if you've had reconstruction, if you've had a lumpectomy, all of this should be safe. Okay, so now we've worked it over to the opposite side, we've worked it down to the inguinal nodes, we've worked it up by our neck, and lastly I want you just to finish up by just putting your hand on your belly, because sometimes when you breathe, you can breathe with your chest or you can breathe with your belly. But if you take a good deep breath in, I hope that you can feel a little bit in your belly. So breathe in through your nose, feel that belly rise a little bit, and then breathe air out. And then breathe air in, and breathe air out. And now take a big smile, and knowing that you've just completed your upper extremity sequence in clearing your right upper extremity.